Sean Connaughton joining us, president of the VHHA, Virginia Hospital Healthcare Association. Sean, thanks for your patience. Thanks for being with us.
Good morning, John. Great to be with you again.
Look, Sean, great victory on the budget, great budget on Medicaid expansion. You're a Republican, I'm a Republican. Both of us fighting this battle very hard, took a lot of heat on it. But I think the final compromise, it was a great conservative reforms in there that Kerr Cox did. But I know that the support of the hospitals in Virginia backing this, I think, is one of the things that put it over the top, right?
Yeah, well, it was obviously a very broad team effort, and it took a lot of leadership in the General Assembly and in the business community, the hospital, healthcare community. We have a lot of people to thank out there who came together. In fact, we had not only the leadership in the House with the Speaker, Speaker Cox and Chairman Appropriations Chris Jones and all the Democrats and 15 or 16 Republicans all came on board and supported this. We obviously had a bipartisan vote in the Senate. The governor did just a wonderful job with this. I mean, everyone really focused on what the long-term impacts are and what we're really trying to do here, and that is deal with uncompensated care, with the uninsured, finding ways to deal with this sort of what we call the coverage gap. And that is a lot of people who are coming into our emergency rooms, who are getting care right now, who, unfortunately we don't see them till it's, in many ways, it's either too late or they've ended up coming in when a small problem has become a big problem, which means it's much more expensive care. But a long-winded way of saying that they've come up with a compromise. We support it. We obviously have never really been a big supporter of these provider assessments. We were willing to put that on the table to get to expansion and see. I mean, one of the things that we wanted to also see is more money put into behavioral health. That's been done in this budget. We've also seen, because this is a crisis that's occurring throughout the Commonwealth, and then also we've been able to get the statutory protections to make sure that this money that we're voluntarily putting into the system here to get expansion, that it all ends up being and staying in healthcare.
Well, Sean Connaughton, here's the thing. Prior to this, every time a hospital, this is not just Virginia, this is anywhere, if you don't have this kind of coverage, every time a hospital sees a Medicaid, Medicare, or uninsured patient, it's effectively losing money. So, I mean, they're losing money off it. And what exasperates it is the people that can't get Medicaid or Medicare because they don't qualify, they make too much money. They can't get an Obamacare subsidy because they make too much money, but then they have no coverage. So what do? You get sick. It's not like you got thousands of dollars stashed in savings to go pay for something. So you go to the emergency room. That's indigent care, right? So the hospital takes you, treat you, they do whatever they got to do because that's the law, right? That's just not out of the goodness of their heart. Maybe it is, but it's also a federal law put in place by Ronald Reagan in the 80s. So they lose money on that, et cetera, et cetera, et cetera. So the whole thing makes no sense. And now the thing is, even though you reluctantly agreed to the provider assessment, I think at the end of the day, hospitals are better off because now you have a system that is going to dramatically reduce indigent care. Somebody texted in the other day and say, well, you qualify for Medicaid expansion. Can you still go to the emergency room? I'm like, well, yeah, anybody can go to the emergency room. But the thing is, if you have to go, it's now you have coverage. But if you can go to a doctor instead of the emergency room, you're going to go to the doctor because you have coverage. Doesn't that make sense?
Yeah, in fact, John, the plan is, and obviously we're going to have to move very quickly on this because the plan is within 6 months to have this program up and running and start offering Medicaid expansion by January 1st. But it's going to go into managed care, and it's essentially the state. Virginia's been a leader in managed care, in having those who are in the current Medicaid program go on to a managed care program, sort of like an HMO, where you do have insurance companies that are helping limit costs and try to get people to the care that they really need at the much lower prices before a problem becomes a major problem. And so we anticipate that you'll see these people enroll in this. they'll be able to get the primary care and other services that will, in the long term, lead to lower costs to both the taxpayers, the citizens of the state, but also in the long term, we're really focused now that we've gotten this, we've dealt with the coverage gap. Now we really got to work together to try to address what everyone is seeing and feeling right now, and that's the ever increasing cost of premiums of insurance, and how do we start to address that? And that's our next focus.
You know, I just got a text here. Somebody said to me, Stan in Richmond says, you guys keep talking about the conservative reforms negotiated by Kirk Cox and Terry Kilgore and others. What are some of those conservative reforms? Can you be a little specific on that?
Sure. Well, the first thing is I just want everyone to understand that the money that the state is going to be put forward to expand Medicaid is not going to be coming from the taxpayers. It's going to be coming from the hospitals, that we're actually putting the money forward. So first off, there's no general fund dollars really going into this program except for the implementation. And by the way, not only are we paying for the federal match that's required for expansion, we're also paying for the administrative fees for running the program. In fact, and so there's no general funds going into that side of it. There is some general funds going into helping run essentially a work requirement and a program for getting people training and education and get them back into the workforce if they meet certain criteria to get the expansion. So this is something that people have been pushing for a long time about trying to make sure that people who do get Medicaid, some sort of government assistance, that they do, and that this is a helping hand, that what we're really trying to do is get them through a period where we can then work with them to get to work requirements, training, education, and get them back into the workplace and off programs like Medicaid. And so there are different criteria. There's going to be probably co-pays. This is going to be a fairly, I'm not going to say lengthy process, because the Trump administration in Washington has laid out certain types of programs that they're willing to accept. You can see in a lot of other states that are Republican legislators and Republican governors have actually gone to the Trump administration, gotten these approvals for work requirements, for co-payments, for managed care, things like that we're going to be pursuing here in Virginia as well. And so we will probably end up with one of the most progressive and conservative programs in the state, in the country, by the time we're done with this, because we can learn what has worked and what has not worked in other states, because right now Virginia will be the 33rd state to actually accept this federal money.
We're with Sean Connaughton. He is the president and CEO of the VHHA, that is the Virginia Healthcare and Hospital Association. He was a very influential player in helping this bipartisan Medicaid expansion program get done. Sean, I've got about a minute and a half. Let me ask you this straight out. So this is not, I just want to be, again, I have to keep saying this because of the lies that go out there. This is not welfare, okay? Sean, in order to be eligible for Medicaid expansion, you have to work, right? Because if you don't work, you get kicked off it. So there is an there's an incentive to work, and also this. I just got to tell you, the argument I keep hearing that, well, when people get it and they're working two jobs at $8 an hour, there's going to be a disincentive for them to get a better job. Sean, you got to be kidding me. Like, people would rather live in poverty and work like weekends and evenings than to get a better job because they're going to get insurance? I mean, you got to be kidding me, Sean.
Yeah. And John, listen, I mean, the problem is that the vast majority of people that will be eligible and will likely sign up for this program are already working. These are people, like you said, who are working hourly wages, and particularly the service industry, who, don't make enough to, essentially buy insurance or be eligible for any of the federal subsidies and all, but they make too much, they make too little, and so they fit into this sort of gap that these are the people that, are working hard, who are having hourly wages, who are working in fast food or janitorial or whatever types of services, laborers and whatever, who we want to encourage and find ways to get them to move to that next level and pursue
That's
the
it.
American dream.
I got to take off, Sean. I'm out of time. I really want to thank Sean Connaughton for being with us, VHHA. Sean, great job. Thank you so much.
Thank you, John. Thanks for all your help. Bye.